We have among us our afternoon session speaker, Dr. Uma Kulkarni. We welcome you to the conference, ma'am.
How many of you have done dissection before? No? Okay. So would you like to see a dissected eye? Yes? Okay. Do you think that by seeing and by feeling the tissues, you will understand it better? Definitely yes, isn't it? That's my theory at least. So we are trying to, okay, we are here. So are you all excited about this program in which we are going to learn from a goat's eye how the anatomy of the human eye is? Okay? You might find that there is a lot of difference, but there is a lot of similarity. So what we are going to learn is from the similarity and not the differences. Okay? So what is the size of the normal human eye? What is the size of the normal human eye? Yes? 2 inches? 3 inches? 1 inch? It is roughly 1 inch in diameter. You can see here, this eye is almost 2.5 millimeter. Like the human eye is around 24 millimeter, 2.5 centimeter. This is 24 millimeter in length. Can you see the structure of the eye? Are you able to see? Okay. So you can see that in the front there is an oval surface. Here, this is the oval surface, and this oval surface is nothing but, what is it called? What is this oval surface here called? Cornea. Very good. Can I hear it loud? Cornea. Okay. This is the cornea. In the humans, it is more circular. In this, it is more horizontal. Behind this, you are seeing a white structure. What is this white structure? Sclera. Okay. The sclera and the cornea are continuous with each other. What is that structure which is present between the sclera and cornea called? Limbus. Very good. Can someone tell me what is the important cell that is present at the limbus? What is that important cell that is present at the limbus? Yes, anybody? It's called stem cells. So stem cells are cells which regenerate and form the corneal cells all the time. So that's called limbal stem cells. So we now, how many structures do we know now? We know cornea, we know sclera, and we know the limbus. Let us go back at the back portion of the eye. Can you see a white cord over here? Yes? What structure is this? What structure is this? Anybody knows? This structure, I'll give you a clue, is a connection between the eye and the brain. Very good. So it is present at the posterior part of the eye. So the eye is located like this. This is the front portion of the eye, anterior portion of the eye. This is the posterior portion of the eye. And at the posterior portion of the eye, this structure called optic nerve is located. Okay, I'll see if it is better seen in this. Yes, it is better seen in this. Yeah. Loud and clear? Yes. Yes. Okay. This structure is better seen in this side. Can you see this? What is the color of this? White. And how thick is it? What is the diameter of this compared to the eye? It is around 3 millimeter in diameter, just like the size of the pupil. Pupil size is 3 millimeter. This also is around 3 millimeter. Can you see this? What do you think is this? A fleshy structure attached to the sclera. What is this? Can somebody tell me loudly? What turns your eyes to the left and right? Extraocular muscle. So can you see this is the extraocular muscle? There are 4 recti muscles. This is one. This is the other 2. This is the third one. And this is the fourth one. There are 4 rectus muscles, and they are superior rectus,
lateral rectus, inferior rectus and medial rectus. They are all attached to the sclera at various distances from the limbus. Okay, see this is around 6 to 7 millimeter, this is around 8 millimeters, this is around 6.5 to 7 millimeters, like that. At different distances from the limbus, the extraocular muscles are attached. Are there any other extraocular muscles? Oblique muscles. Oblique muscles are attached here, very close to the optic nerve. Okay, this is the oblique muscle attachment. So there are two oblique muscles. Can you tell me which are the two oblique muscles? Inferior. Is there a lateral oblique and medial oblique also? No. So there are only 6 extraocular muscles. Okay. Superior rectus, inferior rectus, lateral rectus, medial rectus, superior oblique and inferior oblique. So these are the 6 extraocular muscles which are attached to the sclera. Any doubts? Anybody feels like coming and touching and seeing the structures? Yes? Please come. You can wear a glove and come. 1 or 2 can come, not many. Okay? So did you understand that? All of you? Okay. So now we will try to see what is inside the eye. Please do. We will try to see what is inside the eye. Okay? Now, this is the sclera we said, right? What is above the sclera? Can you see there is some loose tissue over here? Yes, that is called conjunctiva. Conjunctiva is also a very transparent structure. See, I can lift it. Can you see that? I can lift it and that's called conjunctiva. Conjunctiva is attached all around the limbus. So that is another structure which is attached to the limbus and that is called conjunctiva. Conjunctiva does not cover the cornea. Does it cover the cornea? No, it ends at the limbus. So this is the conjunctiva and beneath the conjunctiva is the sclera to which the extraocular muscles are attached. So in the picture also you are seeing the different structures. In case you are not able to see there, let me know. I will show the structures once again in detail. Okay. You can keep moving the slides, please. Okay. So shall we go inside the eye? Yes. What do you think is the structure behind the cornea? What is the structure behind the cornea? Now I will show you. You have to watch it very carefully. Focus alidiyala. Okay. I'll just show you. You'll have to tell me what is happening here. I'm entering behind the cornea and you have to tell me what is happening there. Can you see some fluid coming out? Look at the fluid that came out. What is that fluid? Aqueous. What is the color of the aqueous humor? Colorless. It is a colorless fluid and because it is a colorless fluid, light is able to pass through. Otherwise, we would not have been able to see well. So here I have made an opening through which the aqueous has come out. You can see, can you see the blade inside the eye? Is it seen clearly? This blade is now in the anterior chamber of the eye. The structure behind the cornea and the iris is called anterior chamber. So you can see that the blade is now inside the anterior chamber. Okay, anterior chamber consists of a fluid called aqueous humor. Okay, now you see the eye has collapsed. This is what happens in injuries. In injuries, when there is a full thickness entry into the eye, the aqueous comes out. And when the aqueous comes out, the eyeball is very soft and you can actually feel it. It's very, very soft. Okay? Yeah, please do. Is it soft? Yes. So, shall we now look at the different, we'll just make a cut over here and try to enter the cornea, anterior chamber completely. So once it opens, it's very difficult for a surgeon to suture also because the pressure inside the eye is very low. We need a tense eyeball to suture well. But here now it is very soft because I have already entered and the aqueous has come out. Okay. So I'll have I need little more light over here. Okay. So I'll try to cut this structure over here which is called the cornea. Can you see the dark pigmented, this scissors is not so good. Okay, I'll use this scissors. So, yeah, this is better. So, I'm making a cut in the cornea all around, and I'll show you how the cornea is. Okay, I could have cut it better. Can you hold this for me? So I'm just going to lift. Can you see what I'm lifting now? The structure I'm lifting? Yes? Yes or no? Yes, this is called the cornea. Yeah, don't press. The lens will come out. Lens, okay. Now, keep it. Now, can you see the structure? It's folded. I am putting some fluid here. This structure is called the cornea. See how thin it is? It is like a contact lens. If you have seen a contact lens, you can feel it. Spread it. You can bring it your hand here. I'm putting some fluid here. Can you see the structure? Yes, it's very thin, colorless and very clear structure called cornea. What is the diameter of the cornea? The diameter of human cornea is around 11 to 12 millimeters. Very small, okay? This covers the front portion of the eye. We will keep this here for others to see later, okay? After that, we know that we have now entered the eye. We have opened up the eye and there is no more cornea over here. And what you are seeing here is the iris. The color of the iris is different in different structures. Can you just show the next? Yes. In humans, there are different colors for the iris. You can have a brown. In Indian iris, it's brown. And in the Western countries, you can have light colored iris. Here, the goat's eye is also very light colored. Okay, I'll just cut the structure called the iris and I will show you now. Where is it? Scissors, yeah. So this is the iris. Can you hold the eyeball for me? Yeah. Okay. So I'm just holding the iris tissue here and I am cutting it all around. What is the structure which is present in the not structure, the opening in the center of the iris is called? What is the opening in the center of the iris called? Pupil, isn't it? The pupil was very large over here. And after this comes what is called the ciliary body. Behind this, can you see this glistening structure over here? What do you think is that structure? It's the lens, okay? I'll put a small forceps here to show you the space between the iris and the lens. What is this space called? What space is this? The space between the iris and the lens is posterior chamber. Anterior chamber is between the cornea and the iris, and posterior chamber is between the iris and the lens. So can you see this? This space. Okay, this is where intraocular lenses are also placed. Okay, now are you interested in seeing the, hold it please. Are you interested in seeing the lens? Yes? Okay. I'll cut the complete iris. All she needs to do is make sure the pressure is not too much and the lens will not come out. Okay. Yes. I am cutting it all around. And yes. Now, still the lens is not falling. Can you see? Is the lens falling? Why is it not falling? What is the structure which holds the lens in position? It's called the ciliary body and zonules. Zonules are the structure. Now if I gently apply pressure, the zonules will get separated from the ciliary body and the lens will come out. And this is the removal of the lens. Can you see the lens? Can't I, Diana? Can you see the lens? Is it the first time you are seeing the full lens? Yes. Can you also see that it is like a biconvex structure? Correct? It's like a biconvex structure and it's a very clear lens. Is it cataractous? Do you know what is a cataract? A white opaque lens is called a cataract. Is this a cataractous lens? Is it a brown lens of an aged person? No. It is very clear, indicating that the age of the goat may not be too much. It must be a young goat. Okay, so this is the lens. You want to hold it? How does it feel? It loudly? It is soft. Okay. And what are the parts of the lens? You have to hold it here. Yeah. What are the parts of the lens? Capsule. So outermost part is the capsule and inside is the cortex and in the center is the nucleus. But in this, the nucleus is very, very soft. That's why everything is appearing as same. So we will now put this aside and try to see the next structure. Okay. Now, what do you think is behind? Is there any other transparent structure inside the eye apart from cornea and the lens? Yes? What is that transparent structure inside the eye? It is the vitreous. Okay. Let us try to see the vitreous now. The vitreous is a structure which is present. Where is that instrument? Okay, here. Okay. I'll try to show you the vitreous. If I get it intact, that means the goat was really very, very young. So this is the vitreous. I'm trying to remove the vitreous from inside the eye. I want that expression once again, please. Yes. That means you are attentive. That makes my class useful. Can you see the vitreous? Can you see it moving? Is it fluid? Did it run away like how the aqueous ran away? No, we couldn't hold back the aqueous, but we could hold this back. Why? It's a gel-like structure. So I want her to see this and tell me how is it? It's very soft, jelly form. And there's some attachment of the uveal tissue there. You can see that. So what do you think now is inside the eye? Nothing? Empty eye? Yes. So there is a retina. To show the retina, I'll have to cut the eyeball. But the scissors are not helping me too much. Yeah. So I'm cutting the eyeball like a flower petal and I'll show you what is there inside. Can you hold it for me? That's easier. Careful. Okay. So now I'll invert it and then you can see the retina. I'm inverting it completely. Okay. Yeah. Can you see the glistening structure there? That is the retina. Because now there is no blood supply, you don't see it as a pink structure, orange structure, because there is no blood flow over here. So it's appearing like that. So you can see this is the whole retina. Can you see that? Yeah. Yes. So this is called the end of the retina, which is called the ora serrata. So the edge of the retina which ends at the most anterior part is called the ora serrata. I am putting a blade beneath this. So have you heard of retinal detachment? So retinal detachment is a condition in which the retina separates from the underlying structures. So this is where if I inject fluid, the whole retina will balloon up, and that ballooning of the retina is nothing but the retinal detachment. Okay, so we will try to just peel the structure. Tooth forceps is also okay. Okay. Yeah. See? Okay. It will be attached at the optic nerve, where the optic nerve leaves the eye. So this is all the retina. It's a very delicate structure. See, everything is coming close to the optic nerve, and this is where all the retinal nerve fibers come together and exit the eye in the form of optic nerve. Have you heard of optic nerve head? Yes. So if you now just trace back here, it exactly coincides with the optic nerve which we had seen in the beginning outside the eye. So inside the eye, it is the retina, end of the retina, where all the retinal nerve fibers join. Can you see the dark layer here? See, this is the retina, the glistening layer, very thin layer is the retina. Can you see something dark behind it? Yes, what is that structure? Say, I am inverting it. Yes, it is the choroid. So did you see 3 different pigmented structures in the eye? Which are the 3 pigmented structures you saw in the eye? One is choroid, one is the ciliary body, to which the lens, around the lens you saw some pigmented area, that is the ciliary body, and we first removed the iris. The 3 pigmented structures are iris, ciliary body and the choroid. They are all continuous with each other, and together they are called as uvea. Very good. So that with that we have seen almost all the structures of the eye one by one, and if anybody is interested from this batch to come and feel the lens and vitreous, you can use the gloves and do it. But before that, do you have any questions? Do you have any questions? Okay, I'll ask you the question. What is this? Lens. Why do you say it is a lens? It's a clear biconvex structure. Okay, and what is the dark area around it? It's a part of the ciliary body, which is called the ciliary processes, to which the zonules are attached. Okay, so this is the lens. What was this structure? The flat structure, a thin small structure, cornea. What is the thickness of the cornea? How thick is it? In the center it is only half millimeter. Half millimeter. How much is half millimeter? Try to imagine. And in the periphery it is 1 millimeter, close to 1 millimeter. So that is cornea. And what did you see here? What did you see this? Vitreous. So what are the, now can you just help me in understanding what are the transparent structures of the eye? Cornea. We'll start from anterior. Cornea, aqueous humor, lens, vitreous, and also the inner layers of the retina. They are all transparent. Okay. So these are the and above the cornea, what is the transparent structure? Over the cornea. Don't cry, tell me. Tears. Tears also are transparent. They all take part in allowing the light to go in and form an image on the macula. So did you follow? Any doubts? Was it interesting? Okay. Would you like to see it again? Yes. I would like to ask whether we have 5 to 10 minutes time for quickly to come and see the structures here, and a few of you can use the gloves and touch the structures and see it. Particularly, don't use both the gloves. So you can feel the whole eye and the other structures also. This is the dissected eye. I am keeping, sorry. Okay. Yeah. Take care. Cornea. You can just wet your surface, it's getting dry. Yeah, you can see it.
Session of dissection. So, who are sitting at the back or who came later, kindly wait. We will have another section. Announcement.
There is another session of dissection. So whoever have come late can wait for the second session.
Okay? Yeah, aura serrata and the ciliary body, which is in the pars plana, which is there in the end. You felt it for the first time? Yeah? You had imagined it to be like this? No, how did you think it was? You thought it was still hard, not so jelly like. Okay.